Hello and welcome to today's Rural InReach Westlink broadcast. My name is Susan Lee and I'm the Community Development Program Manager at Women's Health and Family Services. Our panel today is, we have three people from our service. To my right is Janet Page Oliver, and to her right is Sarah Broadhead, and lastly we have Tessa Ryan. And today we're talking about sex, especially sexual health in young people. I'll let our panel introduce themselves first. So Janet, would you like to introduce yourself and a bit about your background?
Sure, thanks Sue. As Sue said, I'm Janet. I'm a registered nurse and I work in the clinical area of Women's Health and Family Services in that capacity. I've also done extra study on sexual and reproductive health, so that's why I'm here today.
Okay, and Sarah?
Thanks, Sue. So my name's Sarah and I work in the Rural InReach team as a project officer. My background is health promotion and public health, and I have a special interest in youth issues and sexual health, so that's why I'm here today.
Okay, and lastly Tessa?
Hi, my name's Tess. I'm in the final stages of my health science degree at the University of Western Australia. I've majored in psychology and public health, and I'm working at Women's Health and Family Services across a number of different programs. Yeah.
Okay. And Tessa, you're from the country originally, aren't you?
Yes, I have a rural background. I actually grew up in Yorkokine, which is 40 kilometres east of Tammin.
Okay, so
Yeah.
we'll say hi to your parents and everything today. Okay, so first, just to start off, the term sexual health gets used a lot, but what does it actually mean? I mean, maybe Sarah, you'd like to sort of start it off?
Yeah, so when we think about sexual health, we initially think of sexually transmitted diseases or pregnancy or maybe a sexual dysfunction, but actually it's so much more than that. It's a really holistic view of sexual health, and it consists of lots of different things, and that might be things like good communication, so discussing your sex life with your partner and feel comfortable discussing sex with your partner. Respect, really important that both people in the relationship have mutual respect for each other. It's about consent. Unconsensual sex is illegal, and it's very important that you want to have sex and you don't feel pressured in the decision to have sex. It is about minimising the risk of pregnancy and STIs. It's very important to stay safe and use contraception. And it's also about enjoyment. Sex is supposed to be pleasurable, and unless you're enjoying yourself, maybe you should rethink your decision to take that step in the first place. Has anyone else? I'm sure you guys have got things you'd like to add to that.
For me, it's sexual health for me brings up sexual responsibility. So it's assuming responsibility for yourself, not relying on other people to fill those gaps for you, to make it into something that it isn't. So it's all about being aware, know everything that you need to know around having safe sex, and making it your own choice.
Mm-hmm.
And for me, I feel it's about having self-respect and having control over your body and making those choices that are appropriate for you. Yeah.
So let's start with sort of one aspect of sexual health, which is sexually transmissible infections. So Janet, what are the most common types of STIs, and how are they contracted?
Well, the most common, particularly in WA, would be chlamydia, which is sort of on the increase, unfortunately. The HPV virus, so the wart virus, and also herpes, so your cold sore type derivatives which are sexually transmissible. So how do we contract them? Well, by having unprotected sex, actually. There's really no other way. You can't get them from toilet seats.
Okay.
Or anything like that.
Glad you cleared that up, Janet.
Okay. And so how would you know, say you had chlamydia as opposed to say herpes or the wart virus?
Well, with for example, the herpes and the wart viruses, you can usually tell you've got those because you have symptoms. Okay, so the wart virus presents as little lumps on the skin. And also the herpes virus is usually uncomfortable, so you may have some discomfort, pain, feel generally unwell as if you're getting a flu. So they usually give you some signals. Chlamydia, on the other hand, often doesn't, and only about a third of people will present with any symptoms at all. And if they do, generally it would be maybe some discomfort when passing urine, and that could be it. And because of that, usually it's the guys who realise that something's not quite right before the girls will pick up on that. Yeah.
So if you suspect that something's wrong down there, so where can you go to be tested, and how much does it cost?
Okay, well, with Medicare the testing is free, so if you've got a Medicare card, and anyone 16 and over can get their own Medicare card, it's worth remembering that, so you don't have to worry about your parents finding out, for example, that you've been somewhere to get a test done. In the country, probably your GP is your first stop. If you don't have a GP, then your district nurse, your nursing post, your health worker, they would all have the capacity to do the screening for you. The screening itself is very simple. It's just collection of a urine sample and a swab, which you do yourself. So it's very non-invasive. It's done in a private space, and very simple to do. The cost, if you don't have Medicare, so if you're a traveller and you're here on a visa, then usually most people in that state would have travel insurance of some sort, or medical insurance. So you would have to pay the account in that instance and then claim it back from your insurance company. Yeah.
So it sounds like it's very easy to get tested. So Sarah and Tess, why don't young people go to be tested? Is there things that young people can do to make getting tested easier?
I think it's a bit of a shame thing. There's a bit of a stigma attached to going and getting tested sometimes, and a fear attached to it as well. I think what's really important to remember is that when you go and see a doctor or a nurse, that it's a confidential space, and you can go under the age of 16 as well. You'll be classified most likely as being a mature minor, someone that's responsible for their own health, and by going to the doctor you're showing that you're responsible for your own health, and in that case everything that you tell the doctor will be kept confidential. I think also just not knowing where to go is a bit of an issue as well, and sometimes the cost can be a barrier, so it's important that we noted before that it's free.
So, and young people can get their own Medicare card?
Yeah. I mean, in terms of doing things for yourself, you can go and get your own Medicare card. You can, get in touch with your local GP, or find a GP that you're really comfortable with speaking to about these issues, and being aware of where your local maybe community health worker is, or STI clinic as well.
Yeah. That's what I didn't mention actually, Tess. That was good prompting. Women's Health and Family Services actually have a telephone service, so you can call us on our 1-800 number, which should come up, should be on the screen somewhere, hopefully. And it's you can call the nurses and have a chat, and we'll be able to give you some advice and recommendations on where to go and what to do. There are sexual health clinics in Perth itself, and there's also Quarry, which is run by Family Planning WA, and that's for people under 25 or 25 and under. So that if you're coming to the city and you want to have that screening done, then there are lots of options.
So Jenna, so once the screening is done, and say if it's positive, what sort of treatment would be involved, and how, what does that cost, and is it long or short, or how involved is it?
Okay, so the treatment for chlamydia, for example, is very simple. It's two tablets which you take as soon as you get them from the chemist, and that is the treatment done. The only drawback to that is some people may become nauseated, or feel a bit sick, or may vomit. And if you vomit within an hour of taking any medication, then that medication is deemed to be ineffective, so you would need to have that repeated. With other STIs, so for example herpes and the wart virus, because they're viruses, there really is no treatment, no pill that will fix it. But there is medication you can take to lessen the severity and the time frame of a herpes outbreak, for example. Yeah, and so certainly that's available. There are other STIs that we haven't mentioned which are not as common, for example gonorrhea, that's a bacterial infection which can piggyback with chlamydia.
Mm-hmm.
So that when the screening is done for chlamydia, it's also done automatically for gonorrhea.
Mm-hmm.
It's more prevalent up in the outer areas or outer regions of WA, for example,
Mm-hmm.
up in the Kimberley, Pilbara sort of areas. That's treated with penicillin, so antibiotics. And generally once treated it's gone. Syphilis is not something that is seen a lot of in WA, and the treatment for that is also antibiotics. And there are some others that are a little bit more obscure, but they're treatable with antibiotic therapy.
Mm-hmm. Mm-hmm. So it sounds like, especially for chlamydia, it sounds like it's a fairly easy treatment. It doesn't sound like it's difficult or a long term or anything.
Yeah,
so I guess, Tess, maybe for you, are there things that young people can do to make access to treatment easier?
I think you'll find there's a lot of e-help available, these being like the online services that we'll mention later, but where you can go on and go through a checklist. It's almost like a self-diagnosis, but it'll give you the information of where to go to get help and just, what the procedures are and things like that.
So if people are, as Sarah was saying, feeling a bit embarrassed or ashamed about going
there's
to
that
their...
access, that can be confidential to yourself, and then you can make the decision for yourself, where you go and get the help from.
Okay. Well, moving on to sort of another aspect of sexual health, which is contraception. So I guess, Jenna, a large part of your work at the clinic at Women's Health and Family Services is talking to women about contraception. So can you just give us a rough idea of the different types of contraception that are available for women in the community? And I think you've got some show and tell as well.
I do. Yes. Very elegant bag here. So the most common form of contraception that people will use would probably be the contraceptive pill for girls and condoms for guys. So this is the pill. It's a combined pill.
Okay.
And that's taken every day. And it can be taken for 3 cycles consecutively.
Okay.
So
I might just see if we can get a close-up of that. So basically you just take it once a day. Do you have to take it at the same time every day, or...?
if it's a combined pill, no. If it's the progesterone only pill, or as it used to be called the mini pill, then yes, you do.
Okay.
Because the efficacy is not there if it's taken all over the shop.
Okay.
On different days.
So your doctor would tell you which pill you're on and things like that. Okay.
Yep.
Okay.
Most people would probably use the combined pill in the beginning. Usually people who use the progesterone only pill would be people who are women who are breastfeeding, people who are sensitive to estrogen and really can't tolerate it in their bodies. So basically that would be the reason.
Okay. Okay. So what else do you have in your little goodie bag?
In my bag of tricks. Okay, I have. So the pill would be for effectiveness. It's 99.9% effective if taken correctly, not missed. You have to remember that if you're on antibiotics, some antibiotics in particular will negate the effect of the pill, and people have been known to become pregnant because they've become ill, still taken their pill, but they've become ill, and obviously
they've thrown up,
or even diarrhea.
Okay.
Can lessen the effects of the pill.
Okay. So if that happens, so to say you get a really bad batch of flu or a virus or something, and you are throwing up or have diarrhea, what can you do? I mean, what happens?
Well, you continue taking your pill, but it just means you don't have sex for 7 days until you've had no more vomiting, diarrhea for 7 days, and that means it's just a 7-day rule when you're on the pill. So if you miss a pill, if you forget, or you go away and you leave your pill at home and you come back, then you actually need to wait 7 days before you can have sex, or before your body has built up that protection again. Okay, so the next ones that are really effective would be Implanon, which is the rod in the arm, and that's actually the rod. So you can see it's very tiny. and it sits just in the arm, just here in between the two muscles. The doctors can insert that and remove those. It lasts for 3 years, so it's very cost effective. It is only progesterone in that though, and so it's great for people who can't tolerate estrogen or who are breastfeeding or just want the convenience of that and not having to worry about taking pills and different things.
Okay, that sounds good.
And Implanon itself is 99% effective as well. Then the next one would probably be an IUD, so an intrauterine device. And basically these are inserted by a doctor into the uterus. So it goes up through the cervix and then just sits in the uterus like that. And the strings come out.
Kind of hang down.
Through the bottom.
Okay.
And that can stay in the uterus for 5 years.
Okay.
So this is a copper one, and it works by setting up an inflammatory reaction to the IUD being in the uterus, which means anything that would land in the uterus, i.e. a pregnancy, would not stay in the uterus itself. So that's that one. This one here is one that contains, called Mirena, and it contains progesterone again. Really effective as a contraception for older women with heavy bleeds coming up to menopausal age, so that's used a lot. There used to be a lot of stigma around inserting IUDs in really young women who hadn't had children, for example. But that seems to be decreasing rapidly, and it's actually being suggested by a lot of doctors now as an ideal contraception for women of all ages, because it's very effective, stays in situ for 5 years, very cheap, and works really well.
And can you feel the strings at all, or do you check the strings?
You have to check the strings. Obviously, if they're too long, become longer, or they become shorter, then you need to go back to your doctor and get them checked to make sure that the IUD is still in the right place in the uterus. But the incidence of anything going wrong with that is pretty small.
Pretty small.
But someone else might not. I mean, a young person might be worried about their partner noticing them. They can't
feel them. No, they can't. So it should be fine. Generally, the strings wind themselves around the cervix, which is this
bit there.
That little part here, which is at the end of the uterus. So generally not a problem at all.
And it's not gonna fall out when you have a period or anything.
No,
like that.
because the cervix is closed and tight, and that will keep it in place. So if it does fall out, it means that the uterus has rejected it, and then you would need to rethink your choice of contraception around that.
Now, can all GPs put an IUD in?
No, they can't.
So
country people, it's tricky for you, I think. Often you might need a referral to the city or your nearest centre where there are visiting gynecologists who probably could do that for you. It can be a bit tricky.
And how about the Mirena, the little rod in the arm? Can most GPs do that, or does that have to be again done?
No, that most GPs. Well, a lot of GPs have done special training on how to put that in. It's a very simple procedure. They use local anaesthetic, so it's not like you have to grin and bear it, really. It's very quick to put in and reasonably quick to take out, so it's really not a big deal. But sure, the doctor needs special training for that as well. There are other things. Now this one here is the Nuva ring. This actually sits in the vagina, and it is the pill. It's just a different way of absorption into your body. This is a combined pill. So it's got estrogen and progesterone.
So it's kind of like this.
It is.
Yeah.
The difference between them is that this one, the pill, the oral pill, is absorbed through your gut, through your liver. This one is absorbed basically from the bottom up, and so it doesn't have the same systemic effects on you. So, if you have a lot of side effects from taking this pill, and some people do, then this might suit you better. Now, as you can see, it's just a rubber ring, and it has the hormones inside it, and they're released slowly over the month. And the beauty of these is that you can actually get an SMS on your phone to remind you that it's time to actually change it.
How often do you have to change it?
Every month.
Every month.
Yeah.
Okay, so like
Yeah.
once a month you take it in and
Yeah.
out. Yeah, exactly.
So with this one, you can't. I mean, it will do its thing. This one you can use back to back, so you can use for 3 consecutive cycles.
Okay.
But this one you can't. You need to replace it
Okay.
every month. Yeah.
Okay.
Yeah. So for some people that works, and probably you're wondering about would your partner feel that with sex? Not usually, no. But you can take it out as long as it's put back in a 3-hour window.
Okay.
Yeah.
And is it pretty easy to take out and put back in?
Yeah, easy. Really easy. Yeah. Okay, then we move on to condoms. So all those ones are sort of 99-100% almost effective. Condoms themselves, the efficacy rate for those is ranges from 90 to 94%. And basically that's around familiarisation, making sure that you're using them properly.
Okay.
So a little bit of practice is good. In fact, a lot of practice is excellent. Because it really is about how you use them.
Okay.
Is how effective they are.
So you can get your banana out of the fruit bowl. Is that what you're suggesting, Janet?
You could try that. There's lots of things from the garden you could probably use. People like to use these with a lubricant, and just remember to always use a water-based lubricant with a condom. Yeah. But
they protect against STIs as well. Is that right?
they do, although you need to be careful or remember with these that they protect against chlamydia, gonorrhea, syphilis, those sort of contact ones. But if someone has herpes, this will only cover the penis.
Oh, okay.
And if someone has herpes on their other parts of their genitals, so on their testicles or on, around the labia area, then that can be transmitted to someone, providing they've got a break in their skin. So, I mean, really, it's about being upfront with what's gone on for you as far as anything that you may have contracted, and letting your partner know, and then letting them make that choice then as to what they want to do and how, how you proceed from there. There's also this is very elegant. This is a female condom, which fits inside the vagina. It looks enormous, but I mean it's effective a bit.
Okay. But these would be much more effective over here. So the implant-on and the pill.
This is not as effective as the male, using just the condom for the male. Yeah. Okay. So then we move on to other things that are not so effective. This is a diaphragm.
Okay.
Which fits over the cervix. So cervix is at the bottom of the uterus, at the end of the vagina, and it sort of fits over like that. So it acts as, it's a barrier method. And the efficacy rate for that is between 85 to 92%. So with this one, it's non-hormonal, so that's a good thing. But we always say to people, if they want to use this, that they must be open to the possibility of a pregnancy, because 15 women out of 100 may fall pregnant with this method. Okay, then there are on to some others, which are sterilisation, obviously 100% effective, not for everyone. Then there's withdrawal, so that's around about 70% effective, and a lot of Middle Eastern countries will use the withdrawal method for contraception. It's the problem with that is that the pre-cum, so when the penis is erect, before ejaculation, there's always pre-cum, and that can carry sperm, which means if the conditions are right, a pregnancy can still occur. And I know people who have actually had that happen to them. Very disconcerting for them. Okay, so I think that's all. Did you have any more thoughts around any of that?
No, not really. I suppose I think it's about people trying the one that's right for them, I suppose. And it might take a few goes. I know that I've had the implant on in my arm. I've got a little scar from it. It's tiny, you can't see it. It wasn't right for me. you know, and I think that's when you're young, you have to go through that process. But I think what we really want to emphasise here is that to protect against sexually transmitted infections, condoms are a must. So even if you're on the pill, you know, if you are unaware of your partner's status in terms of sexually transmitted infections and you're unaware of your own, you know, you need to use a condom as well.
Definitely.
So Tess and Sarah, do you think, I mean, there's lots of choice here. Do you think young people are aware of all these choices, or?
Maybe they're aware, but they may not know the details in terms of, you know, how successful they are, or, you know, the process of using them or inserting them as well. So
A lot of choice as well, isn't there? You know, it might be quite overwhelming for young people, and I think that's why you need someone to talk it through with you.
But I mean, the more choice, the better, really, to find what's, you know, suits the individual.
The other one that I didn't actually mention is the natural family planning method, and there are no real figures on the success rate of that. But the key to that one is it needs to be a mutual decision. So you'll notice the pill, condoms, the Implanon, all those other ones really are gender orientated, whereas the natural family planning methods it needs to be something that a couple will talk about, because there are periods of abstinence within the cycle if you're trying to avoid a pregnancy. So yeah.
And not recommended for young people generally because they have a regular cycle usually, and for that one to be really effective you have to have a pretty constant,
like an established
28-day cycle.
Well, there are different ways of managing that. You can, I mean, because it really is, you need to know your own body. The woman needs to know her own body very well and what's going on for her, because everyone's cycle is different. We're all unique, so everyone's cycle is different anyway. Yeah, so you can work with that.
So Jenna, I've heard about emergency contraception. So what's that? Is that different than all of this, or is that something else?
Well, it is a pill, okay, so it's something that can be used if you know that you've had unprotected sex at a time in your cycle when you could easily become pregnant. It's very effective, but it needs to be taken within 72 hours of sex taking place to be the most effective. So to actually find it, you can access it through a pharmacy. Some pharmacies will not dispense it, and that's their choice. So if you go to one pharmacy and they don't have it or won't give it to you, then you need to go to another one. You can also go to a doctor, GP, to different sexual health centres, your local nurse at your nursing post. So most places will carry that, and it certainly is very effective.
So Janet, the emergency contraception, that's to stop you getting pregnant. It's not to stop you getting STIs. Is that correct?
That's right. Okay. Yes.
So you would need to do something else if you had unprotected sex to prevent STIs. So what we talked about before, or
that's right. So you would need to go and get some screening done. If you've had unprotected sex and you're at risk of pregnancy, you're also at risk of contracting a sexually transmitted infection.
Okay, well, thank you very much for the show and tell. That was great. Okay. Now, often, just on to the next topic, so also about sort of peer pressure and sexual health and sex. I think often you hear the statement, oh, everyone's doing it, all my friends are having sex, especially from young people. So how much truth, Sarah, is there actually in those statements? I mean, you've looked at some of the stats in this area.
Bit of an exaggeration, I suppose. I definitely wouldn't say that everyone is doing it. The reality is that under half of secondary school students are actually having sex. The latest stats show a quarter of Year 10 students and about half of Year 12 students. So not exactly everyone. I think that's maybe the impression that young people get when they're in school, but it's really not the reality. So important to note that if you're feeling those kind of pressures, that actually, you know, you can make that decision and you don't have to go down that path if you're not ready.
So it's not really everyone.
Not everyone, no. Although it might feel like that when you're in school.
Okay.
That's certainly not the case. The stats show us that that's not the case. About 30% of students have had more than 3 partners in the past 12 months, so that's a relatively low number. People are not changing sexual partners too often, although there is a group of students that are. A bit of a worrying stat is that only 50% use condoms, and that goes back to what we just talked about, in that, you know, very important for young people to be using that dual contraceptive at that age. So yeah, but in saying that, there is a large proportion, and it's increasing, of high school students that are engaging in sexual activity. It's gone up a lot in the last few years, and we need to start recognising that and putting some steps in place so those students are doing the right thing and are being safe in their decision making.
And so Tessa, I think you were going to talk a bit about peer pressure and how youth sometimes feel pressured into having sex, even though not everyone's doing it.
Yeah, absolutely. I guess in terms of peer pressures around sexual health, it raises issues with self-confidence, with body image, and then there's also the pressures in social media, just in general media, with sexual messages through TV shows and through movies. And there's also the peer pressures to drink alcohol from an early age, to take illicit drugs, to go partying as such, and still this idea that everyone's doing it when not necessarily they are. And I think in society we tend to think that it's always the females that are pressured before they're emotionally ready to have sex, but I think you'll find a lot of young men actually have a lot of pressure from their friends who claim that they are having sex from an early age. Whether they are or not is not the point. It can be seen as cool, or the in thing to do is to have sex from an early age, and it's not about that. It's about having that self-respect and control over your body and doing what's right for you, really.
So say if a young person is wanting to negotiate consensual sex, what sort of suggestions would you have for them?
Okay, well, consensual sex is a massive issue, and there's a number of steps involved. In Western Australia, the legal age for sex is 16 years, but it's really about when you as an individual are emotionally and mentally ready. And it's about making sure that you have the choice as to who you're having sex with, and what sexual acts that you're comfortable with as well is really important. There are a number of circumstances that an individual is unable to give consent, and this would be if they're drunk, have been drinking alcohol, taking drugs, if they're asleep, if they're unconscious for whatever reason, if they feel threatened or forced or pressured as well. And I guess that raises the issue of sexual assault, is when consent is broken, and sexual assault is a prosecutable offence in Australia. So if anyone's ever found themselves in a situation where they have had their consent broken, or they know someone who has, I would suggest getting in contact with police if you feel comfortable, the nearest hospital. In Perth we've got SARC, the Sexual Assault Resource Centre, and or just getting in touch with someone that you trust, whether it be family or friends, or family friend or something.
Now I think SARC has a number of outreach sites around Western Australia,
and they also have a phone number as well. People can access.
And so, but women could also ring the clinic, and they could have a bit of a chat over the phone, and they could stay anonymous if they wanted to. So that's again, I guess, another option.
But I would just add that as an individual, you have many sexual rights, and it's important to remember that you have the choice to decide when you start having sex and who you have sex with, and what sexual acts you're comfortable with. And it's okay to say no to some and yes to others, and it's okay to say no even if you have said yes before. And just because you're in a relationship with someone also doesn't mean that you have to have sex as well. So it's about doing what's right for you.
And then Tess, you were also going to talk to us a bit about how young people can kind of read other people, the body language around all of this, because I can still remember how awkward all of that was, and I think everyone goes through that awkward phase of being young and new at it and all things like that.
I guess it kind of relates back to the peer pressures of, drinking alcohol and taking drugs and partying. Those sort of activities that alter your body and can alter your control of your decisions and your options and things like that. And I suggest for young teens or those who are, turning 18 and going out to bars and things like that, it's basically just to be really aware of your safety, not accepting drinks from strangers, not leaving your drink unattended, not taking that lift home from a stranger or that offer to go for a walk or to a bedroom or something like that, because you've got to be really aware of your own safety and make sure that you're in control of the situation. And in saying that, you also have to be aware of your own actions and how others may perceive, your intentions as well. Yeah.
So, so what are some ideas about how to stay safe, I guess, for Sarah and Tess, or all of you guys?
So going back to that initial conversation in terms of contraception, so to use condom preferably, and also maybe a hormonal method as well. Having said that, if you're in a steady relationship and you both have had a sexually transmitted infection test and that's come back negative, you could make the decision to just use the pill. But that really needs to be something that's communicated between two people. Like Tess said, making sure that you want to have sex and that you don't feel pressured and that it's your decision and no one's taken that decision away from you. Talking to your partner about it, discussing what you want to do, what you don't want to do. And I suppose, have you guys got anything else you want to add? There'll be lots of ways to stay safe, I would imagine.
I think maybe just being open about sex and sexual health, to your family and to your friends. It's not a shame topic, and that's going to give you that extra safety as well. Letting people know where you are if you're going out, and if you are going partying and you are drinking alcohol, it's about having that control. Really.
Going off that gut instinct as well. If you feel that a situation's not quite right and you start to feel uncomfortable, trust that instinct and try and get yourself out of that situation as quickly as possible.
I liked what you said, Sarah, around if you're forming a new relationship, for example, and you know that it's going to be just with that person, then ideally, if you've had previous partners, to get yourself screened first before you start having a sexual relationship with them. And that for me is assuming sexual responsibility, and that's a good place to start.
And getting that quite often, between when it's a male and female relationship, women often take a lot of the responsibility for the sexual stuff. They're the ones that do all the contraception thing and are putting the emphasis back on your partner, because it's about the two of you. It's not just about one.
Yeah, definitely.
And so what programs are currently available for young people in Western Australia?
Yeah, so there's lots of information out there. Just want to comment on a quick stat that I found before we started. The most common sources of information for young people these days is the internet. That's 85%, which is great in some ways. The internet's got a fantastic amount of resources, and I'll talk about them in a second. What's most worrying is the second most, source of information is friends. 96% of young people get their information from their friends. Now, great to talk to your friends about sex. Probably I wouldn't be getting all your factual information from them. They might not quite have their facts straight. Might sound like they do, but not always. Best to talk to someone that's in the know. And magazines as well is the third. Things like Cosmo and Dolly maybe was something I used to read. Yeah, Cleo. Again, often they do have their facts right, but sometimes not. They're not the best sources of information. So using those really good internet sites, which I'll go over in a second. School education system in public schools is usually on the ball. Sexual health clinics and that kind of thing. Porn as well is 64%. Also a bit of a worry. Porn doesn't...
not reliable
not
information.
No, it's movies. Probably best not to get your information from there. Okay. So there's the FPWA Sexual Health Helpline, and that's 1800 198 205. Then there's our helpline at Women's Health and Family Services, and it's 1800 998 399, and we'll have all these numbers available for you after the show. There's also a great website which we talked about earlier briefly called Could I Have It? And this is an online website, and you go on and you do a bit of a questionnaire, and it tells you whether you're at risk, and then it gives you a form, and you can print out the form and go to a Path West clinic, and there's lots of those around WA, and you just take in a urine sample. You don't have to see a doctor, you don't have to chat to anyone, it's all really confidential, and that can really take some of the shame away.
Yeah, you don't have to go to the family doctor. And
You do have to be over 16 though,
Okay.
so that's the important point with that one.
Okay.
There's a great government website called getthefacts.health.wa.gov.au. That's got all the correct information. Like I said before, sexual health education in public schools, usually the school nurse will be pretty approachable, and again, she has to maintain confidentiality. It's part of her job, so you could approach your school nurse if you're happy to. Your local GP through WA Country Health or your nurse, and also regional women's healthcare centres. So there's one in Bunbury, and there's one in Kalgoorlie, and one in Headland as well. And they'll specialise quite often in STI screening and sexual health stuff. I'm sure I've missed
I think there's one in Geraldton as well.
There is.
And I mean, we've talked quite a bit about when your relationship is between a man and a woman, or a young woman and a young boy. How about for same-sex relationships? Can they still use those helplines?
Definitely.
Okay, so the same ones. That's not going to be a problem at all.
Yeah, and really important as well. You know that those that are in same-sex relationships, they're going through the same type of stuff, and they can access the same type of information. They shouldn't feel embarrassed. Yeah.
Okay, we're nearly to the end of our show, so thank you very much for joining us to our panel. And just to recap for our audience, the numbers and the websites will be coming up shortly. And I think, Sarah, you were saying they're all confidential websites, and they're not going to be telling parents and friends and relatives.
And the two numbers that you can see up on your screen, they're both free call from regional areas, so that's important to mention as well. Okay,
and if people also just want to have a bit of a chat and then find out some more, they can always ring Women's Health and Family Services.
Yep, give us a call.
So do they need to explain to the receptionist why they're calling, or can they just so they could just say, can I speak to a nurse?
Yes.
Okay, so they don't have to go through the whole...
No,
okay. Which is good. So I think that phone number is also at Women's Health and Family Services is also up on the screen for people to look at. And again, that service is confidential, and the phone call is free as well. Thank you very much for joining us here at Rural Inreach on our discussion on sexual health, and we'll see you next time.